Getting to know your community can make a huge impact in how you take care of people and what you can do to really promote their well-being, okay? So the Lakota people are a part of the Oceti Sakowin here in the Midwest, okay? That name actually means friend or ally, okay? There's 3 dialects, Dakota, Lakota, and Lakota, and we're all in this area. It's actually an Avengers movie that you can watch in Lakota, fun fact. You know, those are the people that have been in this area for thousands of years, okay? And of those people, there are 7 bands or 7 council fires. Each one of these bands has its own story, you know, behind how we earned that name, okay? The term Sioux, which is commonly found on legal documents, is actually not something that we gave ourselves. It's derived from an enemy term, Nadasu, which actually meant like a snake or snake in the grass. So, yeah, you know, we know who you're talking about, but again, it's not the name we gave ourselves. So when looking at Native American health, we view it a little bit differently. You know, all, you know, cultures, I feel like, had their own method of medicine and healing and traditions, okay? A lot of people still use a lot of herbal medicine today. So the idea of health, or Wichozani, is something that's not just physical, it's something that's mental, it's something that's spiritual, it's something that, you know, traditional healers would address all of those things, which, you know, can be quite a difficult task. So kind of thinking about that, everything has its balance, okay? So if there's something off in one area of your life, you know, if there's some really terrible emotional problem, you're probably not gonna feel up to going and getting your cancer screenings or getting your routine lab work. And so then just, you know, the culture itself is very built upon finding your center and understanding your connection to the world around you, okay? And then, you know, I'm sure some of you probably heard about some of the Lakota ceremonies and things that, you know, not just Lakota people do anymore. And that all kind of stems from the teachings that were provided to us by the White Buffalo Calf woman, who was essentially the Lakota version of like prophets that you find in the Bible, okay? And she gave us 7 sacred rites or ceremonies. So that's Inipi or Sweat Lodge, which is probably the most well-known. Hamblecheapi, or crying for a vision, praying with sincerity for an answer, essentially. Wiwayang Wachipi, or the sun dance. Hukapi, which is something I think that gives us a significant amount of strength. So that's making relatives that aren't blood relatives, okay? Wanagi Yuhapi, which is the keeping of the soul. That's a way of mourning over great loss. Ishnatia Wicholoampi, which is a girl's coming of age ceremony. And then Tapa Wakayayapi, which is a throwing of the ball, which is, again, putting a lot of understanding and strength for the role of women in society and how much power they carry, okay? So we just kind of wanted to briefly kind of run through some of these to try to give you a brief kind of peek into traditional health, okay? And I think these things can still go very well with like our ideas of Western medicine, and in fact, might cover a lot of bases that we just kind of don't typically treat in the clinic, okay? So that's a sweat lodge, essentially like a kind of a prayer sauna, okay? And then this is kind of an older image from a Sundance. And if you're curious about any of these things, you're welcome to, you know, ask some questions, okay? One thing that hasn't been around for thousands of years is something called the Native American Church that's also quite popular, okay? And essentially what that is it's a church that was founded on use of another medicinal plant called peyote. And people consume this, and they've actually done studies that show they're more likely to, and probably because of the requirements of going to this church, but they're more likely to be able to maintain sobriety. Children tend to do better in school, and this is just a very like dedicated church, okay? So these church meetings run all night, okay? And then kind of looking back at some other values that, again, might affect care. So we've got, these are some of them, okay? So the Hochekia or prayer, that's very important. I think, working for an Avera system as well, it's kind of nice because it gives like people permission to be able to pray, both in the healthcare setting and the hospital. And you should be allowed to do that anywhere, but it's something that's more kind of in the core of understanding there, okay? Other values, are very similar to what most people might have. Woki, the generosity one, that one is a little bit different, I think, for us than for most people, and that's the idea that you are responsible for your neighbor, okay? So you are expected, if you see a need, to try to fill it, and that's what traditional leaders were. It wasn't just people that kind of lived in isolation. It's people that connected to those around them, and if someone was needing like a piece of clothing, they were needing food, it's your responsibility as a leader to see that need is met. So, and then kind of going back over to traditional herbal medicine. So these things actually do have both, again, thousands of years of use, but then also they actually can impact your care in other ways. So pejikota or sage is something that was commonly used for like stomach ailments. We use it in ceremonies. It's got some antimicrobial properties. You put it in wounds, those kinds of things. Chashasha or red willow bark is actually active ingredient is salicylic acid, which we commonly know as aspirin. So, just kind of give you some ideas here. And then, we didn't just, harvest medicines, but, even like the diet that we had here was very diverse and kind of probably dependent on the season. But, things that are from this area, so everybody knows about buffalo. Not a lot of people know that corn, beans, and squash were actually from the Americas, okay? So, and then there's some just examples of some different things. I see we have a shout out on a fun book there. All right, and then one other thing we kind of wanted to mention just in terms of like taking care of Native patients and the idea of those connections. So, language actually has some bearing and can tell you a lot about like a culture. So when we talk to other people, you meet somebody, you're spending time around them, usually the respectful thing is to use a relative term. So I might not be related to you, but if I addressed you and you were a little bit older than me, we would address you as uncle or auntie, and that's the same kind of respect you were supposed to carry for like your neighbor or the person that lived in your community. And then also that kind of meant that we do have quite large families, not just the tiwahe or the household, but our tioshbes were quite large, and we still kind of carry on that tradition. So sometimes you'll see a patient, you'll walk in and there's like 5, 6 other people in the room. And that's considered normal, okay? So traditional like family connections are also a little bit different, so that can complicate your care just a little bit. So it's not just parents' job to raise the kid. So it's grandmas, it's grandpas, it's aunts, it's uncles. And traditionally, parents actually didn't do a whole lot of punishment. It was your aunts and uncles that did that. So you could maintain that close tie. And so it kind of in that way, understanding that there's a lot that goes into one patient and their connection, their families. So a lot of people involved.
So I just wanted to kind of go back now and just talk a little bit about healthcare and how it's delivered. Originally, healthcare was delivered to Native Americans originally around the time of settlers coming, and a lot of diseases that were never in the Americas before, like smallpox and some of those things that came. Because of that, there was need for care for Native Americans that were around the settlers in that area. So originally care was provided by the Army around the forts, and then care eventually expanded and was under the Bureau of Indian Affairs. And then shortly after that, in 1955, the Indian Health Service was formed. But unfortunately, the Indian Health Service has been chronically underfunded. Actually, it gets its funding when it comes down through things, not through Congress directly, but through the President's discretionary fund. And there's actually 2 different pots of money that are given through Indian Health Service, one to run facilities, and the other to be able to provide services that are outside of the Indian Health Service buildings, like if you need, for example, coming to Sioux Falls for further care. So I just wanted to go back a little bit and just do a little bit of history. And I put it that way because a lot of times we hear what history is based on what we're taught traditionally, but there's really more to the story. So back in 1830, Congress actually passed an act, it's called the Indian Removal Act, to try to remove Native Americans. And of course, after that, there were a lot of different skirmishes out there. A lot of them had to do with land, people expanding, moving westward. And then in 1868, the Fort Laramie Treaty was actually signed, and that was supposed to guarantee sovereignty for Natives. It was supposed to carve out what areas that they would live in for the future generations. And then in 1880, because of a lot of skirmishes that were ongoing, there were some religious ceremonies called the ghost dance that were held. And it caused a lot of fear and concern. And because of that, they actually passed a law that outlawed us from practicing our religion. And then 1887, there was the Dawes Act, or the Surplus Act, because again, more settlers coming, they needed more land. There was the Wounded Knee Massacre in 1890. But we weren't actually citizens of this country until 1924. After World War I, when a lot of Natives contributed to service, we were finally made citizens of this country. And we weren't allowed to practice our religion in this country until 1978. Just kind of strange considering this country is kind of founded on religious freedom, but healthcare is affected by a lot of things. I mean, and we hear all the time stories of, Medicare patients who have to choose between medications and food. I mean, so we know economic factors play a large role, but there are some unique issues to Natives. Part of it has to do with colonization. The loss of land, the policies that keep forcing us to move, reservation life itself. And I'll have a couple slides to show you some examples of reservation life. There were issues where children were removed from their homes, trying to get them assimilated into the mainstream cultures. There's a lot of issues with trust because a lot of things happened to Natives over the years. Again, religion, when we feel religion is really part of our health and our ability to be healthy, and then you're not allowed to practice it, how can you be a healthy people? And then there's something called generational trauma. So this is an example of what the area that was supposed to be was actually almost the entire western half of South Dakota would have been the area for the Great Sioux Nation. This is kind of to show you where we are now and how we're spread across the state of South Dakota, but definitely much smaller places than was originally guaranteed in the treaty. Reservation life was actually very difficult. We were forced into areas that really weren't suitable for farming, weren't suitable for basically raising cattle or anything else at that point. Most places either had the white robes or the black robes, so Episcopals or Catholics to come and kind of settle boarding schools, trying to teach Natives English, try to teach them mainstream culture, but basically was trying to get us assimilated and minimize conflicts. Unfortunately, we now, even today, have two of the poorest counties in the whole United States in South Dakota, on the Pine Ridge Reservation and the Rosebud Reservation. They're very isolated communities. They're very difficult to get from one place to the other. We have a lot of housing issues. There's housing shortages. It's very difficult to get good, healthy food out there. You have to travel a long way. So these are examples of a couple of homes, and these ones are still out there. I mean, these are things that people still live in. This is an interesting slide that I found, just showing comparing the homes that we have on the reservations, USA Res, versus Africa, Haiti, and Mexico. So I mean, we have places that are very similar to very poor countries right here in South Dakota. In 1953, somebody had the bright idea, let's just take all the Natives off the reservations and get them into the cities, and they can find jobs, they can find places to live. And so they did originally it was supposed to be voluntary, but it kind of got to be somewhat forced to get people to move away from the reservations into the urban places. But they had a lot of problems. They had unemployment, they had low-end jobs, there's lots of discrimination, people became very homesick. And they didn't have their traditional cultural support because, like we said before, we're very extended families, and when you have that extended family around you, that's a lot of good support. But when you took that away, then it was an issue. And originally back then, about 8% of Natives lived in cities, and now more about 55, 65% live in cities. So there's a lot more Natives in cities than there ever used to be. The other thing that became an issue for us was then in 1969, there was actually a lot of children that were taken from their homes and sent in to live in adopted homes, foster homes. And it was estimated up to 35% of Native children were removed from their homes and placed in these types of situations. And there was actually up to about 40,000 Native youths were removed. Because of that, there was something called the Indian Child Welfare Act that was passed to try to eliminate that from happening, and that children would stay within their Native culture if we could. Of course, there's a lot of legal issues, and we hear lots of things in the news these days about legal issues and the violence and things that happen to people when they're arrested. But nothing's really ever said about Natives, and we're actually 3 times more likely to be killed during a legal intervention than Caucasians in this country. The other thing that I mentioned briefly was generational trauma, and it's something that historical trauma, it's a cumulative emotional and psychological wounding over the lifespan and across generations. And we definitely see that among our Native people. And because of that, we definitely see the impact on healthcare these days. And a lot of issues of both physical, psychological, it's forced onto the next generation. And because of that, we see problems with substance abuse, depression, anxiety, self-esteem issues, anger, and suicidal thinking. Just kind of one way to look at it, the tree remembers what the axe forgot. Mm-hmm. The other thing I mentioned too was that we have issues of getting food. I mean, if you live way out in the middle of nowhere, there's very few grocery stores. If you don't have gas for your car, or you don't even have a car, it's hard to go 40, 50, 60 miles to a small store and get food. So a lot of people, unfortunately, are getting their food from the gas stations, which, as most of us know, most of the time don't have the most healthiest food. So, a lot of our children are having problems with obesity. About 35% at age 4 are already obese. And this is impacting our health. Because of that, we've had huge issues of heart disease, and people are dying because of that. We did, over the years, Indian Health Service put a lot of different things out there to try to improve things, the Diabetic and Prevention Acts and things like that. So we started to see some improvement. Our life expectancy was hitting around 70, which, for Caucasians was about 78 around the same time. So it wasn't quite up there, but it was getting better. And then, unfortunately, other things happened. So this was an article from 2 years ago. The South Dakota Health Secretary said Native health disparities are a jaw dropper. In this study, they showed that 50% of white South Dakotans will die before the age of 80, whereas 50% of Natives will die before the age of 58. Of course, liver disease, and we have very high rates of alcoholism, and for drinking the same amount of alcohol as other cultures, we have 4 times the rate of cirrhosis and death. Unfortunately, COVID hit us quite hard. We talked about our extended families, but because of housing shortages, we're all crammed into places together, and it definitely impacted us. The other statistic that they noted is 25% of Natives will die before they're 45, compared to 15% of African Americans and 7% of whites. That's 1 in 4 people. That's a lot of people that are dying at an early age. Some of the things they cited that were contributing factors, because of vacancies among physicians and other healthcare staff, there was a lack of ability to access good healthcare. There was lack of continuity of care because we have lots of turnover on our reservation hospitals. People don't want to stay in rural, isolated areas. 25% of Natives felt that they were sometimes or never able to get good care, whereas 12% of other races had that same feeling. The other thing that impacted us dramatically was suicide rates. They're much greater than they are for Caucasians. And in fact, when I worked in Rosebud several years ago, we actually had the highest rate of suicides in men between 18 and 25 in the world. Not just in the United States, in the whole world. And 50% of Natives have been shown to have even had suicide thoughts in the last month. And 39% of them had a plan. And that's a very scary statistic. Other things that we have had issues with, pregnancy-related complications and deaths. The CDC has recently shown that 2 times more likely to have a complication relating and causing death. But they also noted that despite challenges, American Indian and Alaska Native people continue to be resilient and thrive. One of the issues that has to do with, that causes a lot of this, and they already noted some of the issues of not having enough physicians and other people out there, has to do with funding. I mean, if you look at how much money is spent on a Medicare patient, typically in this country, it's about $12,000. For veterans, it's about $9,000. Prisoners is about $7,000. Native Americans, it's about $3,000. So that's a big difference. And again, I mentioned the pots of money. The pots of money to run a facility is fairly large, but the money that's there to help get people off the reservation for care, which is typically not provided there, is a very small pot of money, and it's rationed. As a physician, one of the things that we had to do every day was to sit down and look through all the things that the people that needed to be referred out for and decide who got to go and who didn't. That's hard to do as a physician. I mean, my job was to make sure that they got care, but we couldn't do it because we didn't have the money. So we had to prioritize it, and so those things that were life-threatening or limb-threatening got paid for, but nothing else usually did.
Right. So kind of looking, to the future, I know we've got some different points there, but it's our hope that, people will continue to get educated on, their native neighbors here and, how their culture might be impacting their care. But, if you are a healthcare provider, it's also my hope that these things and, learning more about history and why that patient that comes in maybe isn't super happy to see you, maybe isn't gonna always do what you say. So, even looking at like the maternal mortality rates, if just a generation ago, so like in the 60s and 70s, there were some places where up to a quarter of women had sterilization without consent. How do you trust the doctor to deliver your baby if you think that there's a chance that they might not let you have more? And it's just, there's all of those studies. There's things that just other people don't understand at a baseline because they've not had to worry about it. Why would I not trust my doctor? And so, based on those things, generational traumas, ignoring the importance of like those cultural ceremonies, you're making more barriers than are already there. And so, we need more funding, but that's a whole different topic there. But definitely more understanding from the healthcare community and even just the community at large. I know we talk about an alcohol problem, but Native American people are also far more likely to totally abstain from alcohol than, like, say, European descent. And part of that has to do with like our ceremonies and things that you have to be sober for. You have to try to live, on that red road or the road that's focused on health, essentially. And so, I think a lot of good points were made, but we still have a lot of learning and a lot of way to go.
And I think the other thing too is just, we also know that in any community, if you get people who are from that area, from that community, to go to school for anything in the healthcare field and they come back, they're much more likely to stay than people who come, and just have an obligation to work for a public health service scholarship or, want to check it out and see what it's like. They usually leave fairly quickly, but people who are from that community are more likely to stay. So the more people we can get educated, the more people we can get to come to, health field, whether it's physicians, PAs, nurses, we can get them to come back, they're more likely to stay. And so we're going to get better care that way. And this is the reason we're doing it, for our next generation. As natives, it's what we always look forward to is, what can we do as next generation? So I just wanted to show, these are my grandchildren. My husband and I, we have 8 of them. So, they're very important to us, and we...
Only 3 of them are mine, okay.
But yeah, so that's the way forward, is whatever we can do to educate, whatever we can do to help, that's what we're here for. So.